This is my audience, Roger and Karen. There are 206 bones in the body, and imagine if one or many of those bones was affected by a disease. Fibrous dysplasia is a rare bone disease that can affect any bone in the body. In my case, it affects my hip, femur, and tibia. Today I'm going to inform you a little about fibrous dysplasia, some signs and symptoms, and some treatment options. First, I'll talk about the overview of the disease, and then I'll talk about the signs and symptoms, and I'll end with the treatment options. Fibrous dysplasia is a rare disease that destroys good bone and replaces it with fibrous bone tissue. The tissue is not hard like normal bone, but it is soft and almost string-like. Fibrous dysplasia usually occurs in childhood between the ages of 3 and 15. Males are more commonly diagnosed, but a specific type called McCune-Albright syndrome is more common in girls. Now that we know a little about fibrous dysplasia, let's talk about the signs and symptoms. There are two forms of fibrous dysplasia, monostotic and polyostotic. Monostotic is when only one bone is affected and it usually has no signs or symptoms. It is often diagnosed on an X-ray accidentally for another reason. Polyostotic is when many bones are affected, but the most commonly are the femur, the tibia, the pelvis, the ribs, the skull, and the face. Some symptoms are more severe and include bone pain, difficulty walking, deformities, and fractures. The symptom I experience the most is the bone pain. Even though fibrous dysplasia is an incurable disease, there are treatment plans and medications that can be taken. One medication that is used and that I'm currently on is pamidronate. Pamidronate inhibits bone breakdown, preserves bone mass, increases bone density, and relieves pain. Surgery is a treatment plan when deformities are suspected. Metal plates, screws, and rods are used to stabilize the bones. I currently get the pamidronate infusions every 3 to 6 months to help with my pain, and I've also had surgery to place the rod and screws into my hip and femur. Today I educated you on the bone disease fibrous dysplasia. I started out by giving a little overview of the disease, and then I switched to the signs and symptoms, and I ended with the treatment plans. Now that you know a little about fibrous dysplasia, you can go inform others about it. And I'm giving an interesting fact sheet to my audience.